I've had an additional 9 years of training beyond everybody else, and it's taken a little bit of a toll from me in terms of my family life and maybe years off my age because of all the work I've done. I guess I've been a little bit of a nerd, but again, I have an interesting background. So let me just talk to you briefly about that so you can understand where I'm coming from. I'm from San Antonio. I'm a product of the West Side. I grew up on the West Side. I'm a product of the San Antonio Independent School District. I went to Jefferson High School. From Jefferson, I attended Stanford University. I went to Stanford Medical School, and you may know Stanford's one of the best schools in the world. I did my training at the University of Texas Southwestern Medical School in Dallas, and that was also one of the top 3 programs in the country as well. I did that in internal medicine. I went on to become board certified in geriatrics. In fact, I was voted the best geriatric doctor in San Antonio here several years ago. I went back and got an MBA in healthcare management. And then subsequently, I went forward and got a fellowship training in anti-aging and restorative medicine. That's a branch of medicine that deals with things naturally, and they're very progressive in terms of what they do. And a lot of what I say, unless you're very knowledgeable about that, can become controversial. And we'll talk about some of those controversies in the future as well. And I also did the fellowship training in metabolic cardiology. So as you can see, I've been a bit of a nerd over my lifetime. I've been in practice for 37 years, and I've been voted one of the best doctors in the country over 30 times in my lifetime. I was recently voted one of the best doctors in the world, and I'm also on the clinical faculty as a clinical professor at the University of Texas here in San Antonio. And I've done that for over 30 years as well. So what I'm going to talk about today is healthy aging. I'm going to talk about initially the Blue Zones. The Blue Zones was a book that was written by Daniel Buettner. And Daniel Buettner, this is about 12 years ago, that it was a bestseller in the country for over a year. And it's something that I refer to in my practice because it makes common sense. And if you can follow these guidelines, you will live a longer life. And it's estimated that if you do these things, you could potentially add an additional 10 years to your life as well. So I'm a big believer. So let's talk about the Blue Zones then. They called it the Blue Zones, by the way, because when they had a map of the world, there are 5 areas in the world where you had the most number of people who lived over 100. And they kind of circled them with blue ink, and that's how they got the name the Blue Zones. Funny how they put that together. Those 5 areas in the world are Sardinia, Italy, which Sardinia is a small island on the coast of Italy. Okinawa, Japan, very discrete population. Loma Linda, California, and I'll talk about why Loma Linda is interesting and important. The Nicoya Peninsula in Costa Rica, which is a small area, and most of these areas are kind of isolated. So, you don't have big cities because, if you have people in New York City or San Antonio or Chicago, you don't have people do the characteristic things because the population is so diverse. And that's what makes these areas unique, because they're small populations and people kind of do the same things. And the last of those 5 areas is Icaria, Greece, the Icaria Island in Greece. So Sardinia, Italy, Okinawa, Japan, Loma Linda, California, Nicoya Peninsula, and Icaria, Greece. So again, I want you to understand, a lot of people say, well, I can't live to 100 years old or 80 years old because my parents died of 50 of this and that. So what I want you to understand that 80% of what we do to live a longer life is not genetic. It has to do with our lifestyle. 20% is only related to genetics. Now, if you have a significant cardiovascular predisposition because of lipid issues or what have you, that might be a little bit of a different story, but there are things that we can do to help reverse those as well. If you have early Alzheimer's in the family, your risk of Alzheimer's is a little bit more higher. But there are things we can do to forestall the onset of Alzheimer's. So what we really die of in this country are cardiovascular disease, cancers, and Alzheimer's. Those are kind of the big 3. And it's interesting because I'll talk specifically about Alzheimer's because one of the issues with Alzheimer's, it's interesting. People now, most people, they did a study that showed more people are afraid of living with Alzheimer's than dying of cancer. So it's something I want you to focus on and I want you to think of. And in fact, in this country, if you live to age 80, your chances of developing Alzheimer's is about 1 in 4. If you live to 85, it's a coin flip. So if you live to 85 in this country, your chances of having some degree of Alzheimer's is 50%. So there are things we can do to forestall. We can't never prevent Alzheimer's, but we can forestall the onset by 6 or 7 years of good years. So that's important. So let's talk about the blue zones. Okay, there are 9 characteristics, and I'd recommend that you get this book. You can buy it anywhere. The Blue Zones. I think they've had newer editions as well by Daniel Buettner. Could you give me water, please? I'm sorry. Sure. But there are 9 characteristics. One of the most important ones, the first characteristic, and these are common in all these areas, you have to stay. Thank you. You have to stay active. Exercise is very important. In doing so, hopefully, you'll try to maintain an ideal body weight. You want to get a BMI, body mass index, between 23 and 25. Those things are important. But if you can stay active and exercise 45 minutes a week of interval training, and we'll talk about that in a little bit as well, this is what is probably the most important factor in terms of living a long life. People who exercise on a regular basis, they have less cardiovascular disease, they have much less Alzheimer's. What exercise does, by the way, it lowers markers of inflammation. Anything that causes an inflammatory response is bad because it increases your risk of Alzheimer's to a significant degree. And in fact, as an FYI for diabetics out there, if you have diabetes, your risk of getting Alzheimer's is significantly higher, at least twice normal. So you want to get that diabetes under control because diabetes causes a generalized inflammatory process that significantly increases your risk of cardiovascular disease, as you know, peripheral vascular disease, and Alzheimer's. And as you know, people who have diabetes also have a much higher risk of heart attack and stroke and losing limbs and such, kidney disease. So staying active is very important. And it's not necessarily going to the gym. And people say, oh, I've got to go to the gym. No. In most of these countries, these are out where there's not a lot going on. It's not like they have gyms in the Nicoya Peninsula in Costa Rica or on the island Icaria, Greece. People stay active doing whatever they do, whether it's riding a bike, whether it's hiking, whether it's that they're taking care of their sheep and they're out working and walking all day. But any kind of aerobic activity is good. If you want to know the best exercise, it's interval training, where you go from high intensity to low intensity. So, for example, if you're on a treadmill, you can jog at a good rate for 3 or 4 minutes, and then you can walk for a minute or two. So the interval training, going from low activity to high activity and going back and forth, is what's good. Now, people who run marathons, by the way, that's not necessarily a healthy thing. Marathons, it's not natural to run 60 minutes at a high rate of speed. And people who exercise and do marathons, they tend to be very thin, and actually marathon running can actually cause an inflammatory response. So I don't recommend marathon training for that reason. It does not necessarily make you healthier. In fact, for those of you who are knowledgeable about, one of the guys who wrote the first book on exercise and about marathon running was Jim Fixx, and he died at like 50 years old of a heart attack. So again, that kind of speaks to what I was referring to in terms of excessive aerobic activity can cause inflammatory changes that increase your risk of dying early as well. So 45 minutes, five times a week is probably great. And this causes the kind of lowering of inflammatory levels that we're talking about. Now, these things are not, we can't get these, if you go to your doctor and ask, oh, I want to check my levels of inflammation, that really isn't very helpful. And most of the time, insurance doesn't pay for that anyway. But you can safely exercise 4 or 5 hours a week, interval training, without any difficulty. I'm going to just take a drink here because my throat is a little dry. So again, staying active and exercising doesn't have to be exercising. Anything that keeps you active will lower your risk of inflammation, lower your risk of Alzheimer's, and it also keeps you limber. And people who exercise, they just live a longer life. And in fact, when I see people, you can kind of get a quick idea when they walk into the room how well they're going to do, and it's just by looking at how much they exercise, how mobile they are in the office. And the other thing that's actually important is who they come in with. If you have an older person who comes into the office and they have their family with them and they're very attentive, guess what? They live a longer life as well. And we'll talk about that. Number two, so staying active is number one. Number two, family first. People who spend time with their family, they do better. They live longer. They have a healthier life. They have more physical activity. They generally have more social interaction. So family first is very important. Many times in these other countries, particularly in this country, we have what I call a throwaway mentality, where people who get old, we don't think of them, we don't respect them as well as we do in other parts of the world. And in fact, they become patriarchs and matriarchs of their family. So being involved in your family is really important. So as you get older, you want to make sure that you're spending time with the family. Many people older also take care of the kids and grandkids and what have you, great grandkids. And those things are important as well. It's good for the kids because you pass on a lot of information, generational information, and it's also good for yourself as well. One of the things that I spend time on when I talk to my patients is I ask them, what makes you click? What makes you happy? What's your purpose in life? And I want you all to think about those things, because if you don't have a purpose in life, particularly as you retire and you're no longer working, and many times when we're working, that's our goal in life, that's our purpose in life. Sometimes that's good, sometimes it's bad if there's a lot of stress at work. But as we get older, purpose in life is important. And people who have a purpose in life, they have a reason to get up every morning, and they do better. So that's extremely important. In fact, they have a term for it in Japan. Okinawa, Japan is the one area in Japan where people live a long life. Actually, in Japan in general, they live longer, but Okinawa is particularly important in that regard. But they have a purpose for that, and it's called ikigai. And ikigai in Japanese is your purpose in life. In Costa Rica, they refer to it as plan de vida, your life's plan. But this is real important as well. If you don't have a reason to get up every morning, you're going to live a shorter life. So I want everybody to think about those things. When you retire, do things that are important, do things that keep you physically active, do things that keep you mentally active as well. But ikigai is very, very important, and it's one of the more important characteristics when I talk to my patients about aging well. Ikigai, purpose in life, is critical. You want to eat well. Eating is important. You want to drink a lot of water. But one of the things that you can do there is one thing, by the way, there is one thing that has been shown to expand lifespan. Only one thing. And anybody want to tell me what it is? Yeah, I guess I'm not going to hear anything, but it's okay. I'll tell you what it is. Calorie restriction is the only thing that has been shown to extend lifespan. They have done many studies that have shown this, whether it be with yeast cells or one of our closer relatives, the rhesus monkey. And what they found was when they had about a 25% calorie restriction, the rhesus monkeys lived what would be the equivalent to 120 years for humans. So calorie restriction over and over again has been shown to expand our lifespan. You want to drink plenty of fluids as well. Number 5, you want to, actually, let me say something else very briefly about eating well. Generally speaking, you want to lower the fats, you want to lower the carbs, you want to lower the processed foods. These things have lots of chemicals, increase your risk of Alzheimer's and inflammatory changes. But so in all of these areas of the world, the 5 areas, none of these areas are vegetarian, but they do eat much less meat than other parts of the world. So much more vegetables, much less meat. So again, you don't need to be vegetarian. In fact, I don't even necessarily recommend that people become vegetarian because they have their own sets of problems in terms of vitamin deficiencies and malnutrition. So I don't necessarily recommend being a vegetarian. If you're a vegetarian, be a smart vegetarian. Make sure that you're getting good complements of proteins with what you're eating. Again, drink lots of water as well. Number 5, you want to slow down. You want to relax. So people who are stressed all the time, again, they also put out stress hormones, cortisol, epinephrine. You're constantly activating your fight or flight mechanism. That's very unhealthy. In the past, when we're chased by these prehistoric lions or what have you, saber-toothed tigers, the fight or flight mechanism was very important. But unfortunately nowadays, because of all the stress that we're under, we tend to have that system activated all the time. So if you're under stress all day long, you're not sleeping well, you're constantly anxious, you're constantly depressed, our bodies put out stress hormones. These stress hormones actually are very inflammatory, and in fact, it's very, very hard to lose weight when we have lots of stress. So that's something that's very, very important. So you want to make sure that you're relaxing over the course of the day. And part of this, by the way, it's very hard to live a good, long life if you're not sleeping well. People should be sleeping 7 or 8 hours a day, not with the use of sleeping pills. There's some natural things that you can do that really help. But sleep is critical. And a part of that actually as well is sex. People who have sex in their life generally have a longer life as well and a more satisfying life. So again, you want to slow down, you want to relax, you want to sleep well. Sleep is critical. I can't tell you how many times I said people who have sleep apnea or other sleep disorders, and if they're not sleeping well, they will never feel good and they will not live a good long life. Number 6, you want to, the Japanese, they call it the 80% rule, and you want to stop eating before you get full. So as you know that when you eat, it will take 20 minutes. You may stuff yourself, and it may take 20 minutes before your body tells yourself that you're full. So eat slower, but you want to try to cut back and eat 20% less calories. That will get you closer to an ideal body weight. You want to be closer to an ideal body weight because, again, being chubby increases your risk of high blood pressure, diabetes, particularly high cholesterol. So, and as I talked about before, the one thing that, without question, the only thing that has been shown to expand lifespan is lower your body mass and eating less calories. When you eat less calories, it slows your genes down, and I call it a software program called sirtuins, that when you go into calorie restriction, it activates sirtuins. Sirtuins are kind of like the software program that tells your genes what to do. What it does, it slows your genes down, it protects your genes, and it also activates proteins that actually kill. See, our cells only live for a period of time, and if they call them zombie cells, and if they're sticking around, they put out something called cytokines that cause a significant inflammatory response that actually kills the surrounding cells as well. So by cutting back on your calories, you're slowing your gene function down, you're slowing the reproduction down, which is actually a very healthy thing because they live longer. So again, you want to try to cut your calories by about 20%. Of these areas, 4 of them, and actually in other parts of the world where they do this as well, wine or alcohol. A little bit of alcohol every day is actually a healthy thing. Alcohol has flavonoids. They have antioxidants that actually lower, again, markers of inflammation. I don't know how much of it is related to markers of inflammation and the positive effect of alcohol, particularly red wine, but it can be any kind of alcohol. And I don't know how much of it's related to that versus when you drink a little bit, you chill. I know 3 or 4 times a week I might sit down and have a glass of wine or a cocktail not more than that, because the opposite of that happens. Too much alcohol is very, very bad for you. It's toxic to the liver. It's extremely toxic to the brain. It increases your risk of having hemorrhagic infarct or strokes. So too much alcohol is very bad, but I would encourage you to have, if you can, a little bit of alcohol every day. Maybe a small glass of red wine would probably be the best thing. But again, any alcohol is probably very good. Now that takes me to Loma Linda, California. The reason that Loma Linda, California, you'd be thinking, why is one area of the United States, why do they live long? There's a very large population of the Latter-day Saints, and they live a very pristine life where they eat very well, they exercise well, they take care of themselves, exercise, and living a good life is a big part of their religion, and they don't drink anything at all. So that's why that area would be different. But otherwise, in other parts of the world, a little bit of alcohol is a good thing. Too much alcohol is a very, very bad thing. So we've talked about 7 things. Number 8, people who have faith, people who are religious, they live a longer life as well. And you may increase your lifespan by 2 or 3 years just by having God in your life. So I don't think it makes a difference what God that is, but having a higher power that gives you hope, that gives you faith, I think that's important. And I tell people about that as well. I never push religion, but I think religion is very important. And I think you know that people who have faith in their lives, they tend to be much more positive. And again, they live a longer life as well. Number 9 is God belongs to the right tribe. What I mean by that is that if you have the right friends, people who help keep you young, people who are active, people who are positive influence, people you can go to during times of stress in your life. Having the right tribe is very important. I have a lot of extremely good friends. You don't need a lot of good friends. You need a couple of good friends, but you need a good tribe to help keep you grounded, to help you during times of stress, to help you with problems that you have in life. Not only do you get benefit from having them there when you become ill or when you have your issues, but there's something very therapeutic about giving as well and helping other people. So I encourage charities for that reason as well. Volunteering, helping other people is a good way to live a longer life as well. So those are the primary characteristics of the blue zones. I'll repeat them again. Stay active, number 1, very important for the reasons we've talked about, lowering the risk of cardiovascular disease and lowering the risk of Alzheimer's to a significant degree. 4 or 5 hours a week of interval training where you go from low activity to high activity. If you are on the treadmill, you can walk at 3.5 miles an hour for 2 or 3 minutes, and then you can jog at 5 miles an hour for 4 or 5 minutes, and you just vary between the two. Family first is number 2. You want to stay close to your family. You all know what ikigai means. You want to have a purpose in life, or plan de vida. Eating well is very important. You want to slow down. You want to relax. You want to sleep well. Sex is important as well. The 80% rule in terms of lowering calories by 20%. You want to maintain a BMI, body mass index, of about 23 to 25. When you start going above that, your risk of complications in life go up. A little bit of alcohol, number 7, every day. Having God, or whatever God that is in your life, is important. And number 1, belong to the right friends and having good friends who will be there for you when you need them. So again, 80% of what will determine how long you live is determined by how you live your life and not by your genetic markers. So I want to end that part of my talk by a quote by Daniel Buettner. And what he says, and I'm quoting him, is you want to drink without getting drunk. You want to love without suffering jealousy. You want to eat without overindulging. Never argue. Keep the stress out of your life. Keep away from toxic people. I think that's real important as well. And every once in a while, and with great discretion, you want to misbehave. So I think people who have a childlike approach to life, who enjoy life, who get into a little trouble every day, not too much. You don't want to have
most guys in general.
Yeah, that's right. Yeah, you don't want to get the police involved in your misbehavior, but you want to misbehave every once in a while. You want to have fun. You want to be childlike. I think those people who laugh a lot, people who don't take things too seriously, I think they do better as well. So again, when you have bad genes, there are things you can talk about. And when you have bad genes, those are things that you specifically want to spend some time with your PCP, your primary care doctor, about as well. So make sure that you address those things because they want to help you in that regard. I've talked about, and I'll speak more about Alzheimer's in a little bit. You might not hear from your primary care physician or doctors in general because most people really don't know a lot about this. I had the blessing when I did my anti-aging program of spending a lot of time with Dr. Daniel Amen, and I'd recommend him, by the way. Amen, like praying Amen. Dr. Daniel Amen. He wrote a book called Preventing Alzheimer's Disease. And again, if you live to 85, your chance of developing some degree of Alzheimer's is about 50%. Okay, so those are the blue zones. I'd recommend that you get the book written by Dr. Daniel Buettner. He has some. It was written about 12 years ago, bestseller. I quote it all the time. I talk to my patients about it on a regular basis as well. So, Heather?
Oh, well, thank you. So we have some other questions that we had that came through. And one of those was, do you recommend vitamins or supplements?
Oh, that's a good question. So most doctors, unfortunately, we have very little training in terms of vitamin supplementation and supplements. And it's very sad because in all the other parts of the world, they do this on a regular basis. They take vitamins, they take supplements. But unfortunately, this is something that medical schools don't always teach us. Part of the reason is because medical schools were developed by pharmaceutical companies as a way to sell their pharmaceuticals. And in this country, unless something is prescribed from a pharmacy, doctors don't, we poo-poo it in a very significant way. I think it's very unfortunate because if we can do something naturally, I believe it's always better, naturally and safely. It's always better than being prescribed medications. Now, when you need medications, that's great, but you want to keep medications to a minimum. If you have diabetes and high blood pressure, high cholesterol, of course, you want to do everything you can. You want to follow your doctor's recommendations. But if you could take vitamins and it lowers your risk of diabetes, and it does, you want to do that. If you want to take certain supplements that lower your risk, lower your weight, those things can be important as well. So what I would recommend as a minimum, vitamin D is critical. And I want you to Google this. Look at what vitamin D deficiency does to you. 95, 98% of all Americans suffer from vitamin D deficiency. It doesn't help, though, that when you look at the normal levels of vitamin D3, vitamin D25 in this country are anything over 30 is considered normal. Well, I don't like normal necessarily. I want optimal. So when you get to a vitamin D level of about 50, you start to lower the risk of cardiovascular disease, heart attack, and stroke. If you can get to a level of 60 or 70, you start to lower the risk of cancer. So Google this to show that what I'm saying is true. I mean, you probably have never heard this from your doctor, but vitamin D is important. And vitamin D deficiency increases your risk of heart attack and stroke. It doubles it. It increases your risk of cancer, 18 different cancers. And in fact, by getting a higher optimal level of vitamin D, you cut your risk of cancer by 18 different cancers by about 50%. So if you want to take something that costs pennies a day, that's cheap and easy and extremely safe, vitamin D. It's kind of hard to get toxic with that, but if you're taking a big dose, you might want to talk to your doctor, have that checked. You can have the levels checked very easily. Medicare, unfortunately, doesn't pay for it, but and most people, you don't necessarily even have to check the levels. I recommend people take anywhere from 5,000 to 10,000 units a day. Easily take 5,000 units a day. If you have any questions, again, I don't want this talk to substitute for having discussions with your doctor, but I promise you, vitamin D deficiency is very important. Vitamin D plays a role in cell multiplication and cell replication. That's what cancer is when cells aren't well replicated and they kind of go crazy and develop cancer. and they also determine the amount of intra-arterial calcification you have. So low vitamin D levels significantly increase your risk of cardiovascular disease on that basis. So vitamin D is very important. I'd recommend that you take a good multivitamin. I like pharmaceutical grade vitamins. You can go on to Amazon or wherever you'd like and get a pharmaceutical grade vitamin. When you get a pharmaceutical grade vitamins, they've been evaluated. They've been very strictly examined by our government, and they go through strict regulation to make sure, number one, that when it says that something's on the bottle, that it's on there. Number two, that it doesn't have anything extraneous or any contaminants that can cause problems. You may remember 15, 20 years ago, there were people who were dying of different contaminants that were in foods and certain vitamins. There were pets that were dying when they got some dog food that was primarily made in China, and there were some contaminants in there that were killing the pets as well. Not to bash on China, but if you get something from there, their quality controls are not always the best in the world. So, and I'm not saying it's necessarily better here, but the bottom line is if it's not pharmaceutical grade, you really just don't know what's in it. So a good pharmaceutical multivitamin is a great idea. You can get a one a day, you can get, men's one a day, what have you. But again, it's not pharmaceutical grade. They tend to make those vitamins tend to be inexpensive, and you get what you pay for. It's probably better to take that than nothing. But when you take the one a day, they for example, will put inactive forms of B12 and folate that your body has to subsequently convert to the active form. And our bodies many times aren't able to do that. So we continue to have vitamin deficiencies. But I was doing vitamin testing for a period of time when they were covered by insurance. And pretty much about 98, 99% of people had a vitamin deficiency or multiple vitamin deficiencies. And micronutrients is a big part of issue as well. So if you have, for example, a low thyroid, a vitamin D deficiency, a testosterone deficiency, different micronutrient deficiencies, chromium, vanadium, different things, that also increases risk of diabetes. So your body does not work well unless it has the vitamins it needs that performs chemical reactions. So a good multivitamin is important. Excuse me. I love probiotics. They sell them at H-E-B relatively inexpensively. Our offices all have a probiotic that has 3 of the major bacteria that we have in our gut. So probiotic, every little tablet has millions of the good bacteria that inhabit our bowel. What happens is we do a lot of things that kill the good bacteria in our bowel. And when we kill the good bacteria, bad bacteria get in there. So people who take probiotics actually have, it's been shown that they have 60% less infections. And when they have infections, they tend to be less severe. So probiotic is important. One of the things I absolutely love is fish oil. It's critical that if you buy a fish oil, you want to take about 2,000 milligrams a day, 2 grams a day. If you buy a fish oil, it's absolutely critical that you buy a pharmaceutical grade fish oil. If you're not buying a pharmaceutical grade fish oil, you're going to have small amounts of mercury. This has been shown over and over again. And even small amounts of mercury are very bad. So this is kind of confusing, so I want you to be careful. So when you buy fish oil, it has to be pharmaceutical grade. How do you know it's pharmaceutical grade? It will say pharmaceutical grade on the bottle. Those words, nothing else. And they tend to be very sneaky because if you go to Sam's, you go to Costco, you go to H-E-B, you look at Nature Made, I think is one of the most popular supplements out there. It's not pharmaceutical grade. They confuse you because they say this product has gone through measures that remove mercury. And they also say things like this. It's been certified by whatever it may be. It may have been certified by, but that doesn't necessarily mean anything. And studies have shown that when you take a non-pharmaceutical grade fish oil, excuse me, you are taking mercury, and mercury is very bad. Mercury is very inflammatory. It significantly increases your risk of Alzheimer's disease, increases your risk of cancer, increases your risk of cardiovascular disease as well. So again, if you're taking vitamins, I recommend that you take a multivitamin. You want to take vitamin D. Vitamin D, again, lowers your risk of cardiovascular disease, lowers your risk of Alzheimer's disease. It lowers your risk of osteoporosis. It lowers your risk of infections. During the COVID, well, it's not a scare, the pandemic, people had vitamin D deficiency. It was shown that they had a higher risk of getting COVID and dying of COVID. And you may remember that one of the things that you did when you got COVID is people took vitamin D3. So vitamin D is important. We've talked about fish oil. Fish oil is highly anti-inflammatory. It's a great supplement to take for when you have arthritis. It causes a lowering of inflammation that helps for chronic pain. It also has something that increases the risk of serotonin that helps for depression. So fish oil is great. And fish oil is one of those things that lowers your risk of Alzheimer's as well. I love turmeric. Another term for turmeric is curcumin. Curcumin is the active ingredient in turmeric. You want to take anywhere from 500 to 1,000 milligrams of turmeric a day. Turmeric is one of the best anti-inflammatories. Actually works better than aspirin. It works best. It works better than Advil or Aleve or any of these prescription non-steroidal medications that lower inflammation as well. Absolutely love turmeric. In fact, in Eastern India, they have a lower risk of Alzheimer's because of turmeric. As you may know, when you eat Indian food, it characteristically has this orange coloration to it, and that's from the turmeric. So they eat a lot of turmeric in India, and they subsequently have a lower risk of Alzheimer's as well. The last thing in terms of supplements is resveratrol. I absolutely love resveratrol. Resveratrol works on the genes, and what it does, it mimics calorie restriction. Resveratrol mimics calorie restriction. It gets that sirtuin complex involved that makes genes live longer. It protects them and kills the dead cells as well. Absolutely love resveratrol. And by the way, resveratrol is the active ingredient in what makes alcohol healthy for you. So you'd have to drink like probably a couple of gallons of resveratrol instead of taking one tablet. And again, you know that too much alcohol is not good for you. So resveratrol is wonderful, and I take anywhere from 250 to 500 milligrams a day. So those are the ones that I absolutely recommend. There are other ones. If you read Daniel Amen's book, it talks about some other vitamins as well that lower if you're specifically worried about Alzheimer's. And if you have a family history of Alzheimer's, you want to pay a little bit more attention to that as well. So those are the ones that I absolutely recommend. Again, vitamin D3, 5,000 to 1,000 milligrams a day, a good probiotic. Fish oil, 2 grams a day. You can take them at the same time, take them with food. It absorbs better. Resveratrol, turmeric or curcumin, and a good multivitamin. So that may have been a little bit more than you wanted, but those are some of the things I take that I'm 66 now. I've been carded here. I don't know why they card me. If you could card me, I have a little bit of a gray hair on my beard, so I have no idea. I think it was during the pandemic, and I had a mask on, so they couldn't see the gray. But so that's what I take, in addition to some other things. And again, you want to talk to your doctors about these things. A lot of people may not know about telomeres. That's something new in terms of what we may be dealing with in the future. Telomeres, it's kind of like a shoelace. It's the plastic at the ends of the shoelace that protect your genes, or things that lengthen your gene, lengthen your genes. And in fact, you can actually do telomere testing that tells you what your genetic age is, which is kind of important versus your chronological age. So there's my answer in terms of vitamin supplementation. Maybe a little bit more than you wanted to, but I would absolutely recommend vitamins. And doctors are wrong when they say that vitamins don't help you.
Oh no, this is all great. And I think you tied into the next question, which is, can you prevent Alzheimer's disease? And going along with that as well as what can an aging person do to keep their memory strong?
So if you follow the blue zones that I talked about, those are the kind of things that you want to do. You want to stay physically active. You want to stay mentally active. You want to sleep well. You want to eat well. You want to use your brain. If you want to take up a new language, if you want to go to classes, they have all these classes you could take through high schools and colleges that are free or very next to being free. anything to keep your mind active is important. In fact, what they find is people who retire young, they tend to have a higher risk of Alzheimer's, because if they stop using their brain, it's kind of one of those things where if you don't use it, you lose it. So to answer the question, stay physically active, stay mentally active, spend time with your family, eat, sleep, and drink well.
And I think you touched a little bit on this one as well, talking about hormonal replacement therapy for both men and women.
So that's an interesting question that somebody's asking. There's a lot of controversy about this, but really not too much controversy if you're knowledgeable about this. Unfortunately, if you go to most doctors in this country and you talk to them about hormones, they're going to tell you that hormones are bad for you. And it's unfortunate, and I think gynecologists are particularly wrong in doing so, because if they tell you that hormones are bad for you, it's sad, but they're wrong. There was a study that was done. It was called the Women's Health Initiative, and this was done in 2003. And it was a big study that looked at 10,000 people, women, who they put on Premarin and Provera. Those are both synthetic hormones that, when you metabolize them, they actually cause cancer and they cause heart disease. And this was done in 2003. And actually, the study was ended very quickly, because what they found very quickly was that there was a higher risk of heart attack, stroke, blood clots, and breast cancer. So because of that study, are we still on?
Yes, we are.
Okay. Because of that study, doctors assumed hormones are bad for you. But what they don't recognize is that a bioidentical hormone is exactly what God gave us. Bioidentical hormones are actually protective, and they lower the risk of Alzheimer's, and they lower the risk of heart disease, and they lower the risk of cancer. But it has to be bioidentical. So if you were to take a hormone, it should be bioidentical. For women particularly, it increases hormone. What happens is that when you go through menopause, actually, your risk for breast cancer and heart disease go up. In fact, in the 37, 40 years I practiced medicine, I've had maybe 2 women who've had a heart attack before menopause, because the bioidentical hormones actually protect you from heart disease and Alzheimer's as well. So it has to be done properly. So you want to talk to somebody who has some knowledge about these things as well. One of the things that I do, Heather, is that as most of my time with Health Texas now, I've been a professor for over 30 years at the Health Science Center. I spend the majority of my time now training our newer doctors, our new generation of doctors, not only in terms of clinical practice, in terms of things that we're talking about, in terms of lowering the risk of heart disease and cancer and things like this, but it's also the social aspects of medicine, because it's very important that when you have a doctor, that you're able to trust them and you have a relationship with them. It's going to be very hard for you to follow advice if you don't like the doctor or you don't trust them. So building relationships is critical. So as a doctor, I spend a lot of time talking to our providers about developing these relationships, because again, if a patient doesn't trust you, things don't work.
Exactly. We did have a question that came on in the chat.
Mm-hmm.
And so, does turmeric interfere with blood thinners like warfarin?
Again, you want to talk to your doctors about this. I've never found it to have a problem with it. I probably would not take excessive doses of anything in that regard, but I would not have a problem to having somebody take a turmeric every day. It does not increase bleeding time. It's not been shown to increase the risk of stroke as well. That's a great question, but again, I would talk to your doctors about that. But I've never had a problem with turmeric or fish oil in any way.
Perfect. One of the other questions was, what about hormonal balancing? I have heard that hormonal imbalance makes weight loss more difficult. Is this true? And if true, what can be done?
It's absolutely true. It's kind of interesting because hormones play a big role in our lives. If you get a dog and you spay them, a male dog, what happens to them? They lay around, they get fat and lazy, they no longer chase the other dogs who are in heat. And that's what happens to people as well. They kind of get chubby and lazy. And it's because of the metabolic effects of having low hormones. And in fact, one of the first symptoms in women who are older may know this, of menopause, it's actually becoming depressed and anxious and developing insomnia. And that has to do with a lack of bioidentical progesterone. And if you can just put them on a low dose of bioidentical progesterone, that grouchiness, that irritability, that depression, that insomnia, it melts away, and it melts away very, very quickly. So the answer is absolutely yes. You correct these hormone deficiencies, and people do better. Not only that, and not only do bioidenticals not increase the risk of heart attack and stroke and cancer, they actually cut your risk in half of heart attack and stroke. You're cutting your risk in half of breast cancer. It's protected. So again, talk to your doctors if you want to make sure you don't have breast cancer, or you want to make sure you don't have prostate cancer, because testosterone does not increase the risk of prostate cancer. But if you have prostate cancer, it can kind of feed it, and it could make the prostate cancer flourish, but it does not cause prostate cancer in any way. And again, you want to talk to your doctor about it. It should be done properly. So you want to make sure you have the proper screening. So in fact, it lowers the risk of heart attack. It lowers the risk of cancer, breast cancer, by about 50%. It lowers the risk of Alzheimer's, and it lowers the risk of, particularly in women, hormonal therapy lowers the risk of osteoporosis. And as people get older, particularly women, they have much more osteoporosis. If you fracture something, your lifestyle changes, and you become less mobile, and you don't kind of do the things you want to do because you're hurt all the time. You develop compression fractures, and you develop arthritis. And many people in this country, as we get older, we live an average age for men at 78, for women it's 81, but we live with chronic disability, and we can prevent a lot of this disability by the things we've talked about as well.
I know I want to live longer, but healthy.
Yeah. So it's not a question of living to 100. I mean, living to 100 would be great. And people say, I don't want to live to 100. Yeah, if you're healthy and you're doing well and you have a good lifestyle, yeah, you want to keep living. But if you're 80 years old and you want to live to 100, if you're thinking about living 20 years in a nursing home, in a hospital bed, that's not what I want to do. And that's what makes us unique from people in Japan, for example, because in Japan, they may live to, I don't know what the average age is, but it's higher than this country. I think it's 88 or so. But with people in Japan, they live to 88. What happens, the last 6 or 12 months of their life become disabled, and they die relatively quickly. In this country, we may live, to 78 or 81 for men and women respectively, but we're disabled a big part of that time. So if you follow the things we've talked about in terms of the blue zones, in terms of supplementation, in terms of exercise, in terms of eating well, you can live like the people who live in the blue zones in Japan, in Costa Rica, in Italy, and these places in Greece, and the people in Loma Linda with the Latter-day Saints.
Perfect. So one of the other questions that we had is, what is the importance of screening for cardiovascular disease and cancer?
Good question. Thanks for asking. So that's what you want to see your doctor for, guys. You want to have a PCP who's the quarterback of your healthcare. You want to make sure you get the proper cancer screenings. As an example, the age at which we now screen for colon cancer, we've been seeing more colon cancer at early ages now. So the recommended screenings start now at age 45 rather than the age of 50. You want to have your mammograms. You want to have your pap smears as well. So there are cancers we can screen for, and you want to make sure that you follow your doctor and you follow those recommendations. The other thing you want to see your primary care doctor for, you want to make sure that you're not diabetic. Half of the people who have diabetes, they don't even know they have diabetes. They're causing tremendous damage. They don't even know it because this is a situation where they may have no symptoms at all. You want to get your blood pressure under control, an optimal blood pressure, and most people don't get there, but an optimal blood pressure is 110/60. So, and I'm not recommending that people who are older get to that, but that's an optimal blood pressure because that's where you really lower the risk of heart attack and stroke and cardiovascular disease. And the other thing that you get when you go to your primary care doctor, you want to make sure that you get all your vaccinations, your routine vaccinations, particularly as we get older, and particularly when we deal with the current and future pandemics as well. And the flu shots, for example, right now, you get your flu shot, get your most recent. There's been a new vaccine for COVID that's come out that covers the variants of Omicron. That will significantly lower your risk of developing COVID. Fortunately, most people have had COVID or they've had the vaccines, so the pandemic is pretty much going away. We're still seeing a lot of this, but for the most part, people aren't getting as sick as they used to because they've already had some immunity from a combination of getting the vaccines and having had COVID already.
Okay, that's good to know. One of the other questions that we had is the specific recommendations for diet and exercise, which you talked a little bit about. And then you talked a little bit, I think, about how to increase, what someone can do to increase balance and coordination.
Yeah, exercise, if you just exercise on a regular basis, again, you don't have to go to the gym. Just do things around the house, staying active. If you stay active, if you're walking, if you're, walking at a good pace, if you're doing things, exercise is not limited to being at the gym. It could be cutting the grass, it can be walking, it can be doing things around the house. But staying active, using your hands, doing chores, that's how you do that. A lot of people believe in Tai Chi. There's lots of different things you can do. But if you're active and you're exercising 4 or 5 hours a week, and you're walking, and you're doing things with your hands, and you're using your brain, those are things that are going to keep you coordinated, help with your balance and coordination.
Perfect. What about weight loss and maintaining skin elasticity at 56 years old?
Are those two different questions, or?
Yes.
So
Well, they put that in, it was put in the same,
okay.
in the same question.
So again, you want to try to maintain an ideal body weight, and that's somewhere on that ideal body weight somewhere between a BMI of 23 and 25. So it's really, there's no magic to it. You have to sleep well, you have to drink more water, and if you want to follow a good diet, Mediterranean diet works very nicely. The South Beach diet is a great diet. Both with the Mediterranean and South Beach diet, you eat much less of the processed foods, the red meats, the greasy, the fatty. So I tell people, South Beach diet is what I tend to recommend. You keep away from greasy, fatty foods. Okay, that's a no-brainer. Fried stuff and greasy, red meats is not good for you. Keep away from the white carbs, white bread, tortillas, potatoes, white rice, pasta, and the sweets. Those are the 3 things that is what makes up the South Beach diet. It's easy, it's safe. Again, the greasy, fatty foods, the sweets, the sugars, the white carbs, and fruits are good for you, but the right kinds of fruits. Tropical fruit is actually not good for you. And then corn is something that also is very unhealthy. And if you think about it, corn is what the farmers feed the cattle to fatten them up, and that's what cornflakes does. So those are things to keep away from. So if you can follow those kind of guidelines and exercise, people lose weight. But what happens, we become much less active as we get older, and we tend to stop paying attention to what we eat.
Sweet.
I know. And you can have a sweet every once in a while, but there's so many people who want to have a dessert every day or with every meal. And what I do, I've lost 10 pounds recently as I've been working less. A lot of people tend to get put weight on when they get stressed. Now that I'm not as stressed anymore, I've lost 10 pounds just recently, just by keeping away from the sweets. I know when I get stressed out, I tend to eat more of the sweets. You start to crave it. But you can just take a taste of something rather than having a full dessert.
Mm-hmm.
And you'll find many times that satisfies you. And and it really depends on how you approach these things as well. Because if you say, oh, darn it, I really want that piece of cake, or I really want it, and that's your mentality, then you're going to eat it. But if you think about it a different way, say you look at that piece of cake, or you look at that lemon meringue pie, or the Snickers bar, and you look at it with the skull and crossbones, you're not going to want to do that, because again, the sweets also are highly inflammatory and increase the risk of heart disease, diabetes, and cancer.
Good to know. So one of the other questions that we had to do with what are the best moisturizers to use?
So you want to take care of your skin for your face and sun-exposed areas. You want to make sure if something has an SPF to it. Otherwise, I don't have a recommendation in terms of best moisturizers. Just get one that's not too inexpensive. If it's too inexpensive, it probably has a lot of additives. Keep in mind that whatever you put on your skin, your body absorbs. So just be careful. Anything that you put in your mouth or you put in your skin, or you put on your skin, you absorb. But get something that protects your face. Get something that protects your sun-exposed areas. From a vanity standpoint, the SPF. Since I was 20, I've always used creams on my face. And I'm glad I did that, because I saw my mom do it as she was older, and as she was growing up, and as I was growing up, and she looked very young. Even in her 80s, she had very little in the way of wrinkles. Smoking is very bad for wrinkles, but protect your skin. And again, I put a moisturizer with an SPF every single day of my life. And if I don't put it on, I don't feel dressed, actually.
Right, because you're used to it.
I'm used to it. You know, if you develop a habit, I think it takes, 3 months to do something. They've done studies, but if you do something on a regular basis, you develop the habit, and I'd highly recommend that for everybody.
And I know one of the things, especially with moisturizers, it can be a little challenging to say this is the best one because everyone's skin is different.
Everybody's skin is different, and people have different needs, whether they have dry skin or oily skin. So I don't have a specific recommendation. Many times the pharmacist could help you. If you go to reputable companies, there's a company I use called lifeextension.com. They've got great products there as well. Lifeextension.com.
Okay. Those are, unless there's other questions out there. I know one individual said, excellent presentation, Dr. Reyna, thank you. Good information, looking forward to the recording in order to review. Those are not necessarily questions, they were reflections for you. But those are the other questions that we had.
I encourage you guys to get a good PCP, primary care doctor, to quarterback your healthcare needs. Again, I'm spending my time teaching our doctors social aspects of medicine, but the things that don't always involve medications. It involves really lifestyle. As you now know, 80% of how long you live depends on how you live your life. It doesn't have anything to do necessarily with medications. So our doctors have specific training in terms of things they can do to lower your risk of dying from these things: cardiovascular disease, screening for cancers, lowering the risk of cancer, and Alzheimer's. I
know I want to live young.
Yeah, absolutely. Hey, people say, I don't want to live to 100, but you know what? I promise you, you live to 99 years old and you're doing well. Yeah, get me to 100. Everybody wants to do it if they're feeling well and they're having these relations with their families and they're having a good life and they have a reason to get up every morning. People have a reason to get up every morning. They always live a longer life.
That would be what I want. So are there any questions at the moment? And if you do, you can place it in the chat or you can take yourself off of mute as well. Looking good would be great, but I want to feel great.
Yeah, and from what we talked about, that's how you feel good, by staying active and exercising and eating well and taking the proper supplements and sleeping well. I don't want to underestimate the importance of proper sleep. It's real important. You never feel good if you're not sleeping well. So many people have sleep apnea that's not properly diagnosed, and you lose weight, and people that sleep apnea actually can go away.
Yeah, I think that was it. The last part was thank you for the wonderful presentation. If you guys do have any questions, you can post it to the chat. Like I said, you can take yourself off of mute to ask the question. And I do believe we got through all of the questions that you guys did have and posted to me prior to the presentation, which I do greatly appreciate.
Well, thank you guys for allowing me to spend the last hour with you. I hope I've answered some questions for you. Again, I may have said some things that you may have not heard before, but again, it comes from an additional 9 years of education, and I'm spending my time making sure that our doctors get similar training as well. God bless and good luck to you.